Welcome back to Secrets of Sustainable Weight Loss. I'm your host, Suzanne Healy, and I am so happy today to be speaking with Dr. Laara Van Bryce. Dr. Laara is a chiropractor and a functional diagnostic nutrition practitioner. And what I really value about Dr. Laara is her intuitive and holistic approach with helping people to change their lives for the better. Welcome, Dr. Laara.
Why, thank you very much. Thank you very much. It's great to be here, Suzanne.
Oh, awesome. Yeah, I'm so excited to speak with you today. So, Dr. Laara, I'm wondering if we could start off, if I could ask you if you'd be willing to share your personal health story with us.
Oh, sure. Okay. Well, it's been a long time. My daughter's 27 now, but when she was right before she was born, and in her young years, I really struggled with chronic fatigue, and it all happened actually, I think, really from an auto accident that triggered it. And I just noticed after the auto accident, I just kind of kept going down and down, and had more fatigue and pain, and and struggle. And it was hard to get things done during the day. Eventually, I actually got to the point where I could just do maybe one or two things during the day, and then I was, I was done. So I started going to a nutrition seminar, and they talked about detoxification, and it made sense to me. So I decided to try it, and it was called, a whole food detoxification, medical food that I did. And I'll tell you, within a month, it really started to turn my life around. And within 2 months, it was even better. So what I found is just, at that time, that detoxification was really important for my health. And it's one of the things that I do quite a bit of with my own patients these days, especially, related to weight loss. I think there's a lot of different things that we can do, but I think the toxins help us hang on to weight a lot. So doing detoxification in weight loss, I think, can be really important.
Yes, I totally agree with you. In fact, I run cleanses like with my clients twice a year because we are exposed to so many things, like in our food, in our air, in the water that we drink. And I find that we need to take that time to give our bodies a break from ingesting new things and try to, give our bodies the opportunity to release those things. So that's great. That's a really great health story that you've been through. So, Dr. Laara, we know that our food choices are important for weight loss. Everybody knows if they want to lose weight, they need to be, maybe changing their foods or looking at things that are affecting them. But what else should women consider if they're starting to feel stuck with losing weight?
Well, first off, I also want to mention that, different foods that are going to help one group of people or lose weight is not necessarily the group of foods that's going to help another person lose weight. So I think that it gets down to really testing either your metabolic type, and there are online tests that you can do that with, or testing your DNA. So doing a swab inside your mouth and testing your DNA. There's labs that will tell you what are your best foods, what type of person, in terms of your metabolism you are. So that I just want to start there relative to, food. How do you know what is the best foods for you to be consuming? For some people, they need, like, say, high protein, and also let me add in that we need to take into consideration our food sensitivities too, along with that. So there are a number of different kinds of, say, blood tests, for instance, that you can do to test for food sensitivities. I remember listening to one speaker, she was talking about how she was really working out hard and the weight was not coming off, and it didn't make any sense until she did a food sensitivity and discovered that she was sensitive to eggs. And that once she went off of eggs, she like lost 20 pounds very quickly. So that wouldn't be true for everybody, but it could be true for some people. So it's really figuring out what kind of metabolic type you are, what's your DNA, what your history, your ancestors, you know, were eating, what makes sense for you. And then also looking at what your own personal food sensitivities are and tweaking all of that together to figure out the best diet for you. So I just wanted to start with, you know, we're talking about food. I think that's really important.
Yes, I definitely agree with you. So when you're talking about kind of your metabolic type, could you go into a little bit more about how you might find that out? I think you mentioned maybe online sources.
Yeah, so we use metabolictyping.com, and it's like 49, $50, and you can take that test online, and it will then give you recommendations, tell you what body type you are, and give you recommendations as to what would be your opportune foods to consume.
Okay, great.
Yeah.
And then food sensitivities would kind of expand upon that if you were maybe having a sensitivity to a particular food. That
Yeah,
testing,
and that would be a blood test.
that's a blood test.
Yeah. And then I want to go into blood tests some more, because when you're trying to lose weight, I think, you know, also looking at your whole metabolic, you know, your comprehensive blood panel is important. You want to see, you know, how your thyroid's doing, how your liver's doing, how your adrenals are doing, you know, all those things, how your blood sugar is doing. So you want to look at all those different things. And you want to make sure, like, say, with your thyroid, that you're doing a whole thyroid panel. You don't want to just do your TSH. You want to look at your T4 and T3 and your free T4 and your free T3 and, you know, your antibodies, maybe your, T3 uptake. So there are different things in there. You really want to get a whole panel. And then another thing that you're going to look at is, say, your lipid panel, because if your lipid panel, if your LDL cholesterol is high, well, that frequently indicates that you have a sluggish thyroid, because your metabolism isn't able to metabolize all the fats. So there's kind of another clue that, you know, you may have a thyroid issue, and thyroid really runs our metabolism. So it's a very important part of the blood work that we do. But that being said, I really think that there's a lot of underlying issues to our thyroid. So thyroid, to me, is really a secondary thing. It's actually a symptom of our body not functioning properly elsewhere. So some other places that we want to check, if we see that our thyroid is low, might be like doing a CBC check, where you're checking for anemia and infection, things like that. You also want to check your hemoglobin A1C and your fasting glucose and insulin, because those are going to tell us, you know, how is your blood sugar doing, because that is totally going to control your weight too. Let's see what else I wrote down here. You know, a lot of times underneath all that too is your gut. How well is your digestion? How's your gut? Do you have dysbiosis, which would be improper flora and bacteria inside your gut, which is actually going to create toxins, which, again, as we mentioned before, toxins cause your body to hang on to weight. Do you have a leaky gut? Are you letting in things that shouldn't be letting into your bloodstream? which ultimately is going to cause some of those food sensitivities, right? Because now you're letting particles of food in that shouldn't be getting in. We want to check to see, you know, do you have decreased hydrochloric acid? That could be done, and decreased enzymes. So you're looking for like H. pylori on your test. That could be a number of different kinds of tests, but I actually like the stool test the best. Then we're also looking for parasites and bacteria and viruses and things like that that are in your gut. And I think, you know, all of us have some level of gut dysfunction these days because of our food supply and our water supply, because our food system is really being tampered with. And we're all being exposed to Monsanto's glyphosate, right? We can't get away from that. It's all across the world right now. And even if we're getting organic food, you know, to the best of our ability, we're still being exposed to it. So now, you know, glyphosate is going to put holes in your gut, causing the leaky gut. It's really an antibiotic, so it can kill the good bugs in your intestines. So let's see.
Dr. Laara, that is a lot of information. You just gave us so many things to think about. Since we're talking like about the gut, and you mentioned like glyphosate contributing to leaky gut, where it kind of like pokes holes in the lining of our small intestine because it's kind of got antibiotic effects. Can that gut lining can it be repaired? How would you go about if that, first of all, how would you know that that might be an issue for you?
Well, there are several different kinds of tests. There's a urine test that we do where you're drinking several different sugars. And these particular sugars are not meant to get through your gut wall. They're meant to just go all the way through. So if we start to notice that, so what we do is we take a baseline of your urine, then we have you drink these 2 drinks, or it's 1 drink, 2 sugars. We drink it, and then we wait 4 hours and we relook at your urine. If we're seeing those sugars in there, we know that you've got a leaky gut, that you're letting these things through. So that's one way. Another way to know if you have a leaky gut would actually be with some blood tests too, through different labs.
For example, what type of marker might you look at through blood to see if you have
well, Cyrex Labs specializes in autoimmune conditions, and so they have a particular test for leaky gut.
Okay, yeah, and that makes sense, because in autoimmune there definitely is that component of enhanced intestinal permeability.
Yeah, absolutely.
Yeah, that's that. Yeah. So with the thyroid, you mentioned looking at underlying causes. If you go and have a complete thyroid panel done and it's showing that, yes, maybe you have a sluggish thyroid, could you go into a little bit more information about what you might look at next? What might be the next thing that you consider?
Sure. So you're definitely going to look at your gut, because I think most people who have thyroid issues have gut issues. So, you know, we'll look at stool testing, we'll look at urine testing, things like that. Also, underlying issues for thyroid could be blood sugar imbalances. It could be adrenal stress or adrenal insufficiency. It could be liver toxicity. That could be from, you know, chemicals or heavy metal poisons. It could be from our food. It could be anyway, a number of different, it could be the products that we're putting on our body. You know, a lot of the I don't want to say cosmetics, but it's
personal
more than
care
that.
personal care
products can be very toxic too.
Right.
So, and the way you're going to look for that is going to be through blood and urine, but also hair. Hair will show us heavy metals too. It could be just a hormone, not just, but hormone imbalance, right? That is going to impact it. The thyroid's part of that whole endocrine system. So definitely hormone imbalances. You can test for that through blood or saliva. And then, well, I did mention toxins. One of the things that I wanted to mention relative to toxins is I think the silver fillings can really impact your thyroid, because as they start to degenerate, they're going to drop down. They're right above your thyroid. So I really think that the silver fillings can have an impact. The fluoride in our water can compete. The fluoride, the chlorine, the bromine, that bromine is now in bread. All those things can compete with the iodine in terms of where it attaches to the cell. So iodine is very important for thyroid. But when you get these other competing halides, then you're going to challenge your thyroid because it doesn't have the elements that it needs to work properly, right?
Mm-hmm.
Let's see what else I wrote down here.
So Dr. Laura, let me ask you, for somebody, so kind of the first step is kind of figure out what foods are going to work best for you. You said maybe the metabolic typing diet, and you could also check to see if you have any food sensitivities. And then after that, there's like a whole myriad of tests where you can look at the gut through stool tests, and you can look at the thyroid with having a complete thyroid panel. If money is an issue for someone, what would you recommend that they start with? Which would be like the most important lab test to start with?
Well, let's see. Well, I think that metabolic typing, questionnaire online is pretty inexpensive at $50. So I think that could be a very good place to start. I think with food sensitivities, that's also really important. And I guess if money is an issue, you can kind of do a little bit of your own testing where you stop eating wheat, dairy, gluten, corn, eggs. Those are kind of the top food sensitivities. And if you can stop eating those for, you have to do it for a while, 3-4 weeks, and then you slowly start to add those foods back in one at a time and see how you feel. I think that would be important. So I guess that's a less expensive way of doing it.
Yeah, and that would be like kind of doing a food elimination diet, if you can't afford the food sensitivity testing. That makes a lot of sense. And it sounds like you were referring to the most common foods that most people are sensitive to. And that's a great way of, doing the elimination diet.
Yeah. So let's see, what else?
And then I think, I'm sorry, go ahead.
I also think adding in digestive enzymes and maybe some hydrochloric acid is a good place to go too. So you start to improve your digestion and improve your protein digestion. And a key actually is if the hydrochloric acid really bothers your stomach, you probably have H. pylori. So there are supplements that you could take that would help kill off the H. pylori. And then there's and then after that, you would probably want to do some supplements that would kill off other bad bugs. I mean, there are some general supplements. They're really professional brands, but just some supplements that would start to improve your digestion, kill off the bad bugs. And then there's these ones that are oriented toward rebuilding your intestinal lining. The mucosa is what we call it. So I think doing those things. And I think it would probably be a little difficult to figure out what to take on your own. Because I think you really need some very professional brands. I don't think I'd go buy something at Costco or Walmart or whatever. But I, I I think that there are some general things that we all have to deal with because of the culture that we live in, and those are going to be, you know, our gut and our gut wall, and killing off bad bugs. I think the dysbiosis is huge. And then, you know, lack of enzymes or hydrochloric acid to digest these foods as we get a bit older. You know, I think that's another issue.
Yes, yeah, I agree with you. Do you recommend adding in digestive enzymes for, any symptoms that somebody might have that you would recommend that they add in digestive enzymes?
Um, well, I think anytime that we have kind of we're aware of indigestion, um, you know, like we eat something and we start to bloat, that's probably a good idea that we actually probably shouldn't be eating that food, and carbohydrates will tend to do that. But on the other hand, you may be able to take some enzymes that would help that. Or if you're eating and you're getting gas shortly afterward, or you're burping, or, you know, there's just something that, you know, something's not right in there. I guess that would be a good clue.
Mm-hmm. Yes, I agree with you. And then for, you had mentioned the HCl with betaine, possibly adding that in. Do you find that people suffering with, I find that people that are suffering with acid reflux or gastroesophageal reflux disease that have been on PPIs for a considerable amount of time aren't, I mean, the PPI is designed to reduce the amount of stomach acid that they're producing. And then that definitely has long-term implications, because we need to have strong stomach acid to be able to digest our proteins and being able to absorb certain vitamins and nutrients through our stomach and our digestive tract. So the HCl with betaine, is there a certain way that you recommend somebody start to bring that into their supplement routine?
Slowly.
Slowly.
So, I mean,
Definitely.
I wouldn't take, like, if I had a piece of fruit or something, I wouldn't take any HCl. But if I'm having a full meal and there's a fair amount of protein in there, I'm going to take some HCl. But like I said, you know, some people's systems are so compromised that they can't handle the HCl. So sometimes there are some supplements that help soothe the stomach too. Gastrozyme is one of those that I have used in the past. So sometimes you have to work with soothing it first before you can start adding it in. And then if you have H. pylori, which is a bacteria that likes to sit in your stomach and wreak havoc, that HCl is going to go in there and really aggravate it. So you have to kill off the H. pylori before you actually go in and add the, you know, you have to kill it off before you add the HCl. And I think mastic gum is one of those things that helps kill off H. pylori. But I usually use not just mastic gum, but a combination of a supplement that has a combination of different things in it to help kill it off, is what I'm trying to say first.
Right, right.
Yeah.
Yeah, H. pylori, I believe we all carry H. pylori, but it can overgrow. And so this is some great tips for, dealing with that.
Yeah, I was also going to add that HCl is really important, not just for digesting our proteins, for instance, in some of our foods, but also to keep the parasites and the bad bugs out. So as they enter, because we're eating food that they're on, it kills them off. So it helps cut down on the dysbiosis and all the gut issues that we have. So
Right.
that's also another good point about HCl.
Absolutely. Yeah, that's a really great point. And yeah, one of the purposes of our stomach acid, yeah, to be able to kind of kill things off that are maybe in our food that aren't good for us. So yeah, and HCl, yes, helping to replace our stomach acid. Yeah, that's a really, really great point. So Dr. Laura, before we wrap up, is there anything else that you would like to share with our audience?
Um, I don't necessarily think so. I guess I'd like to tell you about my free gift.
Yes, please share that. I was going to ask you that next.
Yeah. So what I did was I put together a little blog of sorts. And basically, it gives 40 different symptoms that are associated with thyroid dysfunction. So you'll see there's a huge amount there, and some of the things will surprise you. So I hope that you'll go check it out. And I'm mentioning that in particular because that's so important with our metabolism. We want to keep our metabolism up for weight loss. So we really want to see what are some of the issues that that are signs that our metabolism is off. And in addition, the article, continues to mention that thyroid can be a symptom, not the underlying cause. So you want to keep searching to find out more and more of the underlying causes as to what's compromising your health, because health is something that we need to continue to work on a daily basis. We never totally arrive at health. We always have to keep striving toward it. So I hope that this will help you keep striving toward your great health.
Yeah, what a valuable free gift. Thank you so much for offering that to our audience. And there's a link for that free gift in the daily email that you received today. So Dr. Laura, I want to thank you again for taking the time to provide so much valuable advice and really getting into the functional world of lab testing and a lot of things that are available to women when, they're maybe trying to figure out what foods are going to work best for them, and then to take it another step further and really be able to maybe get to some hidden root causes that might be preventing them from losing weight. So thank you so much. I really appreciate you being here today.
Thank you, Suzanne. It's been fun, and I really appreciate the opportunity to talk with your participants.
My pleasure. Thank you.